First of all, I want to shortly introduce you with a basic technique. What you do in optical coherence tomography is that we basically apply laser light to the different retinal layers, and the laser light then gets reflected, and from the runtime differences or runtime delays and from spectral shifts that occur in this process, you can more or less reconstruct nice 3D images of retinal structures, but you can also use this to do some kind of thickness measurements of the different retinal cell layers. So why is this interesting? As you can see here, this is a non-invasive approach. It's quite fast to do, and so it's tempting to see if there is some detectable alteration in different conditions. Here you can see from the review what is more or less the worst case scenario for the retina and multiple sclerosis. As you can see at the fundoscopy, there is a heavy case of optic neuritis, and this optic neuritis is associated with a thinning of different retinal structures, the so-called retinal nerve fiber layer, or currently RNFL. And here you can see the red areas represent more or less the thinning of these areas. In comparison, you see a normal eye, everything is green here, and this corresponds to normal status.
I hadn't thought of using that. I hadn't thought of using it
as research, a lot of different groups investigated the thickness of these retinal structures, and this was followed over the last years, and just last year quite comprehensive review of all this data, meta-analysis was performed, and as you can see here, and when you remember the last slide, it's no wonder that in optic neuritis eyes, the retina gets heavily damaged, and in all these studies you see a big difference in comparison to non-affected or healthy eyes. But interestingly, you can see a similar effect also in eyes that were not previously affected by optic neuritis in multiple sclerosis, and this suggests that there is also something else going on in the retina in ongoing multiple sclerosis. And this is has not only been investigated cross-sectionally, but also in a longitudinal design. And as you can see here, you start to observe the patient at a certain starting point, and then you see the decrease of several micrometers of these thicknesses over time, over 3 years. This is not only a structural measure, but this corresponds only also to functional deficits in visual function, for instance here in visual acuity. When taking all this data together, there are several hypotheses or concepts that have been developed, and one of these concepts is that damage of one part of the whole functional pathway may possibly also lead to damage of other connected pathways. For instance, if you have a damage in an optic radiation or in the tractus opticus, possibly you will also find deficits in the visual cortex or deficits in the retina. And to more or less be able to assess this, also further structural analysis were performed, for instance, by using standard MRI. As you can see here, there's not only a connection between multiple sclerosis and retinal nerve fiber layer thickness, but also a connection between brain atrophy, as calculated by the brain parenchymal fraction, and RNFLT. And as you can see here, higher RNFLT corresponds to a higher BPF, which means that the decreased RNFLT is a marker for reduced brain volume. We could also in our group verify these findings or reproduce these findings in a substantially larger cohort, and we were also able to include another marker, which is now the total macular volume, not only the retinal fiber layer, but also the whole macular structure is integrated or is looked at in this analysis. Furthermore, we also were interested if there are also metabolic parameters. If you remember, I just mentioned structural parameters so far, but also when we looked at metabolic parameters, here in this case we looked at an acetyl aspartate marker for neuroaxonal integrity. We see that if you see changes in the retina, you will also see metabolic alterations in the visual cortex, which is for us is some kind of evidence that the visual pathway are quite distinct. There still is some connection between these structures. And this is also again dependent on the previous history of optic neuritis, again supporting the concept of transsynaptical degeneration of the major point here. Again, we found that also these different findings were independent of each other in a combined model. So we can look at the visual cortex or at the brain parenchymal fraction independently. Still, we have some predictive effect on the RNFL, which in reverse gives you the opportunity to estimate these parameters by looking at the RNFL. Just in the last few months, new data has been published also on direct affection of the retinal structures, not only by optic neuritis or by transsynaptical degeneration caused by damage of other regions, but also that retinal neurons die directly in other neurodegenerative conditions. And the question now, these are some examples for these findings, and the question is now also if this is some specific finding for multiple sclerosis. I don't think so. And there are also ongoing studies for other pathological conditions such as Parkinson's disease, dementia, and others. And one possibility to further dissect this pathogenetic features of these diseases is then to more or less refine the analysis, go into the different layers again, and be able to look which are the structures or which are the layers that are attacked by some kind of neurodegenerative process. Just to summarize this, we think that it is possible to include optical coherence tomography into the assessment of neurodegeneration in a clinical practice. It's quite easy to do, and it's fast and non-invasive, and the combination of OCT with MRI-based parameters will give you some kind of additional information. We still have to look at these developments in a longitudinal way. So far, the majority of the studies that have been published were only cross-sectional studies. I think this is now the next step, also to be able to judge if this is a possible prognostic marker. And then, of course, it's also interesting if these parameters also reflect some kind of therapeutic efficacy. Okay, that's basically it. Thank you for your attention, and